Anyway, thank you for joining me this afternoon to talk about some aspects of how to go about caring for the eyes, especially in the context of age-related problems. So as we age, the eye, like many of the other organs in the body, do start to function less efficiently, and they bring about problems for the person. Of course, this is a very wide-ranging topic, so I will have to focus on very selected eye disease conditions. And also from the previous feedback, I also realized that, it's not to put too many technical details because it's very difficult to digest all in a very short space of time. However, having said that, I mean, our medical practice is still scientific based and evidence based. So it's very important for me to also put up some data and information to help support the comments or the statements that I make in the presentation. So let's kick off. So for this afternoon's talk, I think I shall focus on a number of conditions because of this importance in our local context. So the first one is diabetic eye disease. And this is a problem because of the growing issue of diabetes in our population. And there are a number of factors that contribute to this, but the major one will be the changes in our modern lifestyle and also in our diet or dietary intake, the food that we eat. So lifestyle is that unfortunately there's more sedentary lifestyle, so people are not so active, relying on transportation, cars and other methods of getting around rather than walking. And of course we're less physical active nowadays. The probably by far the more important factor is the diet, the kind of food that we eat, when we eat it, which is constantly, unfortunately. There's so much easy access to food nowadays. And that brings about the rise in diabetes. And the diabetes has a profound effect on the eye. And we shall discuss a little bit about how to screen and what is going around in the country to help fight this disease through screening. The next topic I would like to cover is AMD, or age-related macular degeneration. So this is an eye disease that affects mainly the elderly people. I'm going to focus some highlights about the treatment options that we have currently available and talk a little bit about how to improve or prevent the disease by changing our supplements of certain vitamins and antioxidants. And then finally, we shall talk a little bit about what is going on in the medical technology space, especially in disease monitoring, and what are the new innovations that I've been involved in to try to help us better monitor this disease in the bigger population. So let's focus on diabetes first. This is a growing concern, and this is a major problem because diabetes affects the slightly younger age group, people who are still in the active working lifespan. And to have their vision impacted is a profound devastation, not only on their lifestyle, but also on their financial capabilities, their earning capabilities. So in Singapore, because it's a first world country, unfortunately, it also inherits many of the first world problems. So this is a growing problem in our population. So the numbers speak for themselves. This is a growing number, and the trajectory of increase doesn't seem to be abating. So to respond to that, actually the government has taken very significant steps, and they have to be applauded to do this. You've heard the health ministers declaring war on diabetes, And I just want to highlight one small project, which is the Singapore Integrated Diabetic Retinopathy Screening Program. So these are a national screening program whereby cameras are planted in polyclinics across the whole country, and patients with diabetes are invited to have their eyes photographed on these cameras, and the images are all sent to a special center to grade and review and the images, and the results are then fed back to the polyclinic. So why is this important? Because diabetes affecting the eye, it's very important that we pick up the disease early on so that we can take effective steps to manage it in order to avoid blindness. So to have a comprehensive way to screen a very large population in the nationwide setting, I think is a very commendable progress. So I've been involved in working at, if this is the case, if we're going to take so many photographs, is there a way to help read the images in a more efficient way? So we worked on developing a computer algorithm to try to analyze the photographs of the eye in order to pick up the diseased eyes so that the reading of the images can be done more efficiently. So this was a funded project that we've been involved. So we use machine learning to try to train up the software algorithm to grade the image correctly. So like a teacher and a child, or master and apprentice, you know, you will have 100 images and you ask someone to grade them into normal and normal. And of course, some they'll get X number right and some wrong. And the beauty of the machine learning is that you can train a software to do the grading. And then after reading one batch and then identifying how many is correct, how many is wrong, then you can use that information to retrain the software again, so that the more images you feed the software, the better it becomes. So this is the approach that we use to train our software algorithm. So eventually we see that this is going to be the setup whereby you have the polyclinics taking the photographs of diabetic patients. The images are then sent to a centralized grading system. And at the moment, it's all done by human graders. But we imagine that our software algorithm can be the interface to help the human graders to grade the image in a more efficient manner. So that's about diabetes and what's happening with the screening front. But I think the important thing is that with diabetes, prevention is better than cure. So many of you who are listening may perhaps have been diagnosed with diabetes. And what happens is that the doctor will prescribe you medication to try to lower or control your blood sugar level. And as your diabetes progress, if let's say your control is getting not very well controlled, the sugar level is still high, what do they do often is to increase the dose of the medication to try to bring down the sugar levels again. But actually you can see that it could be a spiral, in that the more you the disease is poorly controlled, the more medications you are dependent on. But actually another way to think about it is, how about if you cut down the number of calories or the food that you take? Then if you don't take any food, then your sugar level will not go up, right? So instead of thinking about adding on the medication, the other way to think about managing a condition like diabetes is to limit the intake. So what does limit intake require? Actually, it doesn't require any effort. In fact, you just have to stop eating and not eat, or reduce your eating, or increase the time between eating. So between your meals, for example, strictly no food in between. So it's very effortless. In fact, all you have to do is stop eating. The other thing is that, what does it cost? Actually, it costs nothing, right? If you don't buy food, you don't have to spend money. So actually, it's quite a cost-effective way also. But it does require tremendous effort because in our current lifestyle, unfortunately, we have very easy access to food sources. There's coffee shops and food sellers everywhere. In fact, they can even deliver up to you very easily. So I think one way is to think about how to reduce the intake or try to prolong the interval between your eating. And that raises to this point. So in between my talk, I'll start to put all these sharing of some wise words that I've come across. I put the background and purple color to highlight these sites to link it with brahmcentre. So this quotation that I put up on screen, I think you have time to have a look through. But it's an interesting take on how to approach this problem that we talk about diabetes. So like what is poison, right? So he says anything that is more than our necessity is poison. So I think we can view the food or calories as that. By right, we should only take food that we need. But the problem is that often we take food because we enjoy it or it is available readily. So one way to approach this problem is to think about what is it that we need and take only what is necessary, because anything beyond that, unfortunately, will turn around and bite us back and harm our bodies instead. Okay, so that's about diabetes that I shall talk about. I mean, there's also other things about fear, envy, anger, and hatred. How we can have a slightly different approach to these problems. Okay, so we're going to switch gear a little bit and talk a little bit about AMD, or age-related macular degeneration. And I'm very happy to share with you that, there's a lot of work that we're doing in this part of the world to try to understand our population better. So our population meaning the East Asian, including like a Chinese Oriental population, Malays and Indians. So this was a paper that we collaborated on with our colleagues in SNEC and NUH, and we identified a new risk gene for age-related macular degeneration in our population. This was published in Straits Times a few years ago. How big a problem is AMD? In the West, the US, Europe, first world again, is the #1 leading cause of blindness for those who are over 60 years old. And worldwide is becoming a big burden. Again, Singapore being a first world country, inheriting the same problems also, it's growing concern in our population as well, particularly that we have an aging population, of course. And so this account for a very significant proportion of elderly patients who lose their sight. So this picture gives you a flavor of what someone with AMD may experience. So as you can see, the vision affects the central part, while the peripheral vision is relatively spared. Unfortunately, our central part of our vision is the most sensitive, and that's what we need for fine detailed vision, such as reading tasks when you try to read something, or recognizing the faces of your family or loved ones. So the impact is quite significant, although it only affects a tiny area. So in general, when we talk about AMD, we talk about two different types, one the dry and one is the wet type. So the dry is seen by the picture on the right there, where you have yellow dots called drusen. And generally, it affects your vision in a very slow process over many, many years. However, the wet type is when you have abnormal blood vessels growing underneath the retina. And these blood vessels can leak out fluid, causing swelling, or it can bleed. And when this happens, the vision will drop very fast, suddenly. And this can lead to scarring over time also. So what are the treatment options that we have for wet AMD, which is the one that accounts for the severe poor vision loss? So the treatment has been revolutionized in the last 15 years by the use of injection into the eyeball. It sounds a bit scary, but it is necessary for us to inject this medicine called anti-VEGF into the eyeball to where it's needed. And the results are very profound and very good. So these are the number of the anti-VEGF agents that we use currently in the clinics today. So there's Lucentis, Avastin, and Eylea. So what are the results? So here's the data. So bear with me a little bit. And this is a graph I want to go through slowly. And this chart represents the change in the vision over time, which is represented on the x-axis here. So what this graph is trying to show is patients with macular degeneration, the wet type, once they are given the injections over the period of time, if the graph goes up like what is shown here, it means that their vision gains over time. So they improve their vision. And you can see that over time, the vision improves and it can be maintained throughout the study period. And this was patients who were treated with two of the anti-VEGF agents, Avastin and Lucentis. Okay, so this is using the other drug Eylea, and you can see the same kind of benefit was shown. So from the start, you can see that the vision goes up again. So they gain vision, the vision improve. And over this period of follow-up, which is 2 years, their vision can be maintained at that good level over time. But this requires multiple injections. And this was a study that shows we are still looking for new anti-VEGF agent. This is the latest one called RTH258. We were involved in the clinical study, which shows that it was useful. And we're just waiting for the drug to be licensed in Singapore before we can roll it out to our patients. So when we talk about AMD in Singapore, we cannot not mention this other condition called polypoidal choroidal vasculopathy. So this is a variant of the AMD, which is more important or relevant in our population. So in a study that I've done myself, we found out that in our population in Singapore, up to 33% of our patients can have this polypoidal choroidal vasculopathy. We call it PCV. Whereas the population in US or Europe, Caucasian populations, PCV represents a very much smaller group. Why is it important? Because the treatment with the injection is effective for PCV, but we found that if you combine the injection together with a laser treatment called photodynamic therapy, the results are slightly even better and you can get away with fewer injections. So this was a clinical study that we organized from Tock Seng together with our colleagues in Singapore as well as Japan, Korea, China, Hong Kong, and Taiwan as well. And we found that in PCV patients, the combination treatment of injections together with the laser PDT gives the best results. Why is it important? Because the onus is on us to manage the kind of disease pattern that we have in our population. And the onus is on us to try to find the most effective treatment. So I'm very happy that we were able to complete this trial and answer the question about what is the best treatment for a particular disease that is very relevant in our population that we're managing. So we also want to talk about what is the role of nutritional supplements. So supplements are vitamins, antioxidants that you don't need prescription, but whether or not it can help protect our eyes from these diseases, specifically for AMD. And the observation, why is this question arise? Because there has been a number of studies looking at a population base, and they found that those patients or people with diets that is rich in fresh fruits and vegetables, especially the colorful ones, they have a lower incidence of AMD. So it suggests that taking lots of fresh fruits and vegetables can be protective. So from there, there are several formulas of specific vitamins and antioxidants that have been developed that to protect the eye from AMD. But as you can see, there are many different brands with different formulas, which is the best one. And even within the same company, you can see that there are so many different formulations, right? So these are different composition of the different vitamins and antioxidants. So it gets very confusing. So the ARED study, which is called the Age-Related Eye Disease Study, was done almost, well, I guess 30 years now, 1990s. And it has this particular formulation, vitamin C, E, and A. Vitamin A is beta-carotenoid, as well as zinc, the element zinc. And it was tested in patients with AMD, dry AMD, to see whether it confers a protective effect or not. What did they find? It found that in patients with at least one eye with intermediate or moderate amount of AMD or advanced AMD, at least in one eye, taking the supplements can help confer some protection. But it only refers to this group of patients. So people who have moderate or advanced disease, at least in one eye, taking the supplements can help protect them. For patients who have milder form of disease, like early AMD, the study shows that taking the supplements failed to give any additional protection. So this is a graph again, just bear with me. So they've compared the different groups who are taking different formulations, but the important difference is to look at the yellow line here, which is the group that had placebo. Placebo means that the tablet that they take doesn't contain anything. You can see that in the placebo, compared to the group that took the combination of antioxidants and the zinc, which was the AREDS2 formula, you can see that there's a difference in those who develop advanced AMD. So by taking the supplements, you can reduce that risk by about 27% over a course of 10 years. So it doesn't protect you 100% completely. That means those who are taking the supplements, some of them do develop advanced AMD, but it is a lower proportion in those who are taking the supplements and the antioxidants. So overall, over 10 years, the risk of advanced AMD is reduced by 27% in those who are taking the AREDS formula. Okay. So the question is, should these supplements be taken for anybody? Because for good eye health, right? But the evidence doesn't support it. So if you have very mild form of disease, or you don't even have any dry AMD features, taking the supplements is not being shown to be useful or doesn't give additional protection. So we wouldn't recommend it. Are there any adverse effects? So some people may say they're only vitamins, but the problem is that sometimes the vitamins may not be so innocuous or innocent. And in the AREDS study, they found that patients who continue to smoke, because you know that smoking has a risk of lung cancer, but in those who are continue to smoke and at the same time take the AREDS supplements, which contain high doses of beta-carotene, the death rates from lung cancer is found to be increased. So again, taking this kind of high doses of vitamins may not be so innocent, and sometimes they have to be of some concern. So since Arrett's study, which was back in 1990s, there's a discovery or interest in the different types of carotenoids, namely lutein and zeaxanthin. And these are pigments, carotenoids, that are found naturally occurring within the eye. So the logical question is, why don't we take the lutein and zeaxanthin instead of the vitamin A, which in the Arrett's was shown to be associated with a risk of death from cancer. Let's have a look. And the other question that arisen was, what is the role of the omega-3 fatty acids? So these are the fish oils which are found to be high concentration in the oily fish such as salmon and mackerel, I think. Yeah. So there's some population-based studies that shows that a diet that is rich in fish is also been found to be associated with a lower risk of AMD. So the Arrett's 2 study was conducted, and the results have been published in 2013. And just share with you the key findings. What they found was that taking the Arrett's 2 formula, it also helped protect the eye from advanced disease, so there is benefit. The addition of the fish oils, the omega-3 oils, did not confer any additional benefit. Low dose, or they also look at low dose and high dose, found that there's no statistical difference. So with the findings of the new Arrett's 2 study, what they did was a tweak in the formulation of the supplements now. So they replaced the vitamin A, which again, previous study was associated with a higher death from lung cancer in smokers. They replaced that with lutein and zeaxanthin, and they've not included the omega fish oil because they didn't give any additional benefit. So nowadays, if we're looking for taking supplements for moderate and advanced dry AMD, I would urge you to look out for the Arrett's 2 formula, which will be labeled in the supplement bottles. Okay. Now, the main recommendation is, what about for those who have very mild or no AMD, or who are interested, however, in knowing how to protect their eyes? Well, the general advice to have a very balanced and healthy diet, rich in fresh fruits and vegetables, especially the colorful ones, and fish. Smoking is a very big thing that is shown to be associated with increased risk of AMD. So stopping smoking is a very important factor. And if you have moderate or advanced dry AMD, or been told by that by your eye doctor, then you should consider taking the Arrett's 2 formula. I see a number of hands flashing up down, but if you would allow me, perhaps I will take all the questions at the end of my presentation. So I shall carry on for now. Aha, so there's another slide with a purple background. And I think this statement is quite interesting. The best time to plant a tree was 20 years ago, of course, because you know that trees are very slow growing. However, the second best time is now. So if you haven't planted it 20 years ago, what can you do about it? Not really much, right? So the next best thing is to start planting it today. So I think the advice about related to the AMD management is that, okay, if your lifestyle was of a certain type, if you've been eating food that is very low in fresh fruits and vegetables, high in animal meat and no fish. Um, if you realize that now, well, the past is the past. You can't do anything about it. But what you can do is you can change now for the better. So, but I find the most important or most relevant one is the smokers who I meet in my clinic. So they say that, yes, I've smoked for 20, 30 years, right? So actually the best would be that if you hadn't started smoking before, right? But if you had, then never mind, but you can stop now, or you can quit now, or you can reduce your smoking now. And even then, that will confer additional benefit for you in terms of your risk of having AMD. Okay, let's move on. The final part of my talk, I will focus on my pet area of interest, which is medical technology. So this is about trying to monitor disease and share with you some of the innovations that we are involved in. So this is a study that was done and published, I think about 5 years ago, in developing a tool or device for patients with AMD with high risk characteristics in order for them to monitor their own eyes to see whether or not there is evidence of the AMD becoming active. And if there is, then they are advised to come quickly to seek help with treatment, including the injection that I mentioned earlier on. So they developed this device, which is portable, and the patient can administer themselves at home. And they do it at home over a period of time. And the study did shows that those who have the device at home and they were able to come in to seek help and treatment when the disease becomes active earlier. And as a result, this group had a better visual outcome at the end. So to be able to monitor your own health of the eyes at home is shown to be beneficial. So the question is, what about, can we screen for AMD? Should we screen for AMD? At the moment in Singapore, some form of screening is done. So for example, the SIDRP program for diabetes that I mentioned early on, they are also looking out for AMD changes in the photographs of the eye. So a certain level of screening is being conducted. But majority of the eye screening is done in Singapore, at least on an ad hoc basis. So sometimes, your local community may organize an eye screening session, and then you turn up, and then that happens. But it's not a very comprehensive program. So as you can see, for diabetics, there is a comprehensive program. We wonder whether we should also extend that for AMD. So as I mentioned, there are some ad hoc screening going on, sometimes as part of a primary care setting in polyclinics, sometimes as part for some community eye screening, maybe a charity, or sometimes when they are linked with some national event like AMD Awareness Week. So whenever we think about whether we should screen for a disease, there are a few criteria that we need to fulfill. One, that it must be an important health problem. Okay. So we know that AMD definitely fulfill this criteria, because especially in the over 50-year-old. The other criteria is that if you pick up a disease, you need to be sure that there's something you can do about it in order to change the outcome. So an effective treatment for the disease must exist. So we showed that in AMD management, at least, although very early dry AMD, there's no treatment available, we know that for those with intermediate or advanced AMD, taking the supplements can confer a reduction in the risk. So you can do something about it. And also we learned that for patients with wet AMD, giving the treatment, especially the injection, can improve the vision over time. So there is an effective treatment for this disease. Now, the tests for screening, the test itself must be low risk. You can't you don't want to harm the eye, right? And the risk of false positive and false negatives must be acceptable. Otherwise, if you screen up too many people and then, and they are false positive or false negative, then you generate a lot of unnecessary work. So in essence, the key is whether we can develop a technology for AMD screening that fulfills all the criteria we mentioned earlier. And I'm happy to say that we've developed a technology using tracking the eye gaze, and this was taken up into a company called OcuTrack, and we're working on this to try to spin out a solution to try to pick up patients with macular disease. So we look forward to that. So maybe I give you a minute to take a look at this poem about a guest house. And it's a poem that tries to encourage us to accept our condition and whatever comes our way, whether it's good or whether it's bad. And the reason why I put this poem up is that, for all the upbeat messages sharing that I've given earlier about management of AMD, unfortunately, we do know that a lot of patients with AMD eventually will lose their vision also. This is for many reasons. One of them is that because the disease is picked up late, so it's not enough screening activities going on, or not enough awareness, for example. So by the time the patient presents to the hospital, it's very advanced and very late. So that is one possibility. The other possibility is that even with the injection and the effective treatment, you need to maintain the treatment with injections for a long period of time. And after a while, patients may either lose interest, or they get fed up with the injections, or they find that it's financially not, they cannot keep up financially because the cost of the injections are not insignificant also. So over time, even though they may gain their vision, but over time, you find that they lose what they've gained and end up having poor vision also. So a significant proportion of our patients end up having very poor vision over time. But again, as the poem says, sometimes we have to learn to accept whatever happens in our lives and in our condition and in our eyes, and try to take it in a positive way. So I thank you very much for your kind attention and for giving me the opportunity to share with you all that I've done this afternoon. It is a little bit patchy, and maybe the data is been not as full as I would like to have shared, but I hope you can get some of the messages that we try to bring across.